Hi. So, good afternoon, everyone. Thank you for staying till the end of the session. So, I'm Dr. Tanujaa. I'm going to give you the medical oncologist's perspective of lung cancer, and I'm going to apologize because there's some topics that's going to be repetitive from Dr. Steve Young's presentation. But I always tell my kids repetition is good. Then you can remember whatever I've said, right? And before I start, I see that actually a lot of people standing at the back. There are actually quite a fair bit of seats in front. If you want to just come in and grab a seat, that will be fine. Then you'll be more comfortable as well. Yeah, just maybe you can take a minute to there's some seats around. There's some seats here as well. Okay, so great. So this is going to be the outline of my talk, right? I'm going to talk about what lung cancer is, how common lung cancer is. Some of this you've already heard, risk factors, how do patients present. And I think my talk what I want to focus on my talk is a little bit more about treatment of lung cancer, right? How do I treat lung cancer as a medical oncologist? And I always like to end my talks by sharing some of my patient stories with you, because many people have many misconceptions about lung cancer or cancer in general. Right, so we start off with something very simple. What exactly is lung cancer? And lung cancer is really the uncontrolled growth of abnormal cells, right? Is basically, so you can have breast cancer, you can have lung cancer. Lung cancer essentially means growth of uncontrolled cells that begins in the lungs. What happens with these abnormal cells is they continue to mutate, they continue to grow, they become bigger and bigger, and eventually start affecting the normal function of the lungs, right? So you may have some symptoms like difficulty breathing, cough, and eventually these cancer cells can spread outside of the lungs to other parts of the body, and that's when we say this becomes metastatic cancer. You've seen this slide earlier, but this is the Singapore cancer statistics. Lung cancer is the third most common cancer among both males and females in Singapore. And if you look at this slide here, I think this Dr. Steve Young went through this as well. Although lung cancer is not the most common cancer, among both females and females is the cancer with the highest mortality rate. And why is that the case? Because if you look at other cancers such as prostate cancer, colon cancer, breast cancer, they tend to present with symptoms. But that is different with lung cancer. You see, in lung cancers, most of the time when lung cancer is picked up, it's usually either in stage 3 or stage 4. And why is that the case? Because, unlike let's say if you have a breast cancer, women will usually present with a lump, easy enough to go and seek medical attention for it. Lung cancer can come, patients potentially can present with different forms of symptoms with lung cancer. They can have cough, they can have difficulty breathing, you could have chest pain, or if the cancer has spread to other parts of the body, if it's spread to the bone, you could have bone pain, right? But the most common thing is that most patients with lung cancer have no symptoms until it is very late, right? So by the time the patients develop symptoms, usually they are in stage 3 or stage 4, and that's why the lung cancer mortality rate is very high. So what are the common risk factors of lung cancer? I think the number one most common risk factor is smoking, right? So generally, if as I always tell any of my patients or the relatives that come into my room, right, even if they are not lung cancer patients, if you're a smoker, please stop smoking, or if you have exposure to secondhand smoke, that is a definite risk factor for lung cancer. Having said that, is it possible to get lung cancer if you don't smoke? Yes, right? Other risk factors for lung cancer which are less common is genetics. Not so common compared to like breast and ovarian cancers, but there are some studies that shows that if you have a family history of lung cancer, that can increase your risk of lung cancer as well. If you have had childhood radiation to the chest before, that can increase the risk of lung cancer. Exposure to toxic chemicals such as asbestos or radon, right? These are not common risk factors, but these are certain things that can obviously lead to lung cancer, right? I think Dr. Steve Young has gone through this. He explained it with zombies, but I'm not going to explain it with zombies. I'm just going to tell you that in stage 1 lung cancer, essentially you have a tumor, a small tumor and there's no lymph node involved. Cancer hasn't spread to any other parts of the body. In stage 2, the tumor can be slightly larger, or there may be a small lymph node that's involved on the same side of the lung. If you look at stage 3, what happens is the tumor is much bigger, or there are lymph nodes involved on both sides of the lungs. And stage 4 essentially is metastatic cancer, meaning the cancer has spread outside of the lungs to other parts of the body, can spread to the brain, to the liver, to the bone. Right, and as you can tell, as the survival of lung cancer decreases with increasing stage, right, you can see survival of stage 1 lung cancer is very much higher than the survival of stage 4 lung cancer. And of course, the next thing is, can I be screened for lung cancer? This has already been covered by Dr. Steve Young. I'm going to skip this part. I'm going to talk a little bit more about lung cancer itself. Whenever we talk about lung cancer, it is very important to realize that lung cancer is not one disease. Right, so whenever we talk about lung cancer, there are 2 types of lung cancer. Even this is a simplified explanation of lung cancer. About 10% of our lung cancers are what we call small cell lung cancers. 90% of our lung cancers are called non-small cell lung cancers. Today I'm only going to focus on the non-small cell lung cancer. All I'm going to say about the small cell lung cancer, it is a disease that occurs almost exclusively in smokers, very aggressive. But non-small cell lung cancer is the more common type of lung cancer that we see in Singapore and worldwide. So next I want to talk a little bit about treatment of lung cancer, because patients always come to me and they say, hey, how come my friend had lung cancer, he had some surgery done, and why are you not offering me surgery? This patient had radiation, you are offering me chemotherapy. Why is that the case? Because treatment varies depending on the stage and the type of lung cancer that you have. Generally, we say stage 1 and stage 2 lung cancer is considered early stage, and most of the time the standard of care is usually surgical resection. So the patient usually sees the cardiothoracic surgeon, they go for surgery to remove the cancer, but that's usually not the end. After the surgery, we usually give them some form of systemic therapy. It can be chemotherapy, maybe targeted therapy, or immunotherapy, depending on the type of cancer. This is what we call preventative chemotherapy. This is something like what Kate Middleton had, when she had when she had a cancer scare. All the papers reported that she had preventative chemotherapy, or what we call adjuvant chemotherapy. The aim of the treatment post surgery is to decrease the risk of the cancer coming back. In some patients who are very frail, who are not fit for surgery, in early stage lung cancer, we refer them to the radiation oncologist to talk about getting radiation. So when we talk about stage 3 lung cancer, this is what we refer to as locally advanced lung cancer. There is not what we call no one best treatment. Usually what happens in the cancer center, we come together as a team, medical oncologist like myself, respiratory physician like Dr. Young, the radiation oncologist, the surgeon. We come together, we sit together, and then we decide for this particular patient what is the best form of treatment. Some patients may have a combination of chemo and radiotherapy. Some patients may have chemo immunotherapy followed by surgery. So this stage 3 lung cancer is a little bit more complex. Yeah, and the next part I want to talk about is metastatic lung cancer. Metastatic lung cancer generally is something nobody wants to talk about, and most people fear stage 4 lung cancer, because usually we say that when cancer is spread outside of the lungs, we may not be able to cure the cancer. Aim of treatment is then aim at extending life, improving quality of life. But whenever we talk about metastatic lung cancer, this is where we have seen most of the advancements happen, right? So what in the past, in 20-30 years ago, whenever we talk about someone with metastatic or stage 4 lung cancer, everybody will go, oh no, this is a death sentence. But that's not the case anymore, right? In what we have found in lung cancer is we are able to we are able to do something called molecular profiling. What exactly is that? We are able to detect the exact genetic mutation or genetic abnormality that is driving the cancer, and we can give patients targeted treatment to target the particular mutation. And we are able to personalize lung cancer treatment. So you can see two similar patients with stage 4 lung cancer getting completely different treatments, and that is because we are able to personalize lung cancer treatment now. And as a medical oncologist, I deal with systemic treatment. And what exactly is systemic treatment? Systemic treatment is anything that goes into the bloodstream to kill the cancer cells. So if I talk about surgery, for example, if the tumor is here, I just remove the tumor that is here. If there is cancer cells on the other side of the lung, surgery, removing this side is not going to help the cancer cells on the other side. Similarly for radiation, if I radiate this part of the lung, it's not going to affect the cancer cells at the other side of the lungs or anywhere else. Systemic therapy is different in the sense it goes into the bloodstream and it kills the cancer cells in any part of the body. Whenever we talk about systemic treatment, when it comes to lung cancer, we have chemotherapy, we have targeted therapy, we have antibody drug conjugates, which is something new, and immunotherapy. I'll talk a little bit more about this in the next few slides. Chemotherapy is something that we are all familiar with. Nobody likes to be told that they need chemotherapy, because in your mind, chemotherapy equals to very toxic treatment, equals to hair loss. Generally, chemotherapy is something that we use, is one of the drugs that we have in our armamentarium of treatment, very effective treatment that we have in the armamentarium of treatment of lung cancer. But I always chemotherapy is usually, when I always tell my patients that the chemotherapy that's the early stage, one of the chemotherapies, the common chemotherapies that we use for lung cancer does not cause hair loss, and my patients always go, huh? Are you sure? And that is the truth. Usually, so chemotherapy does not immediately equals to hair loss. So that is a myth. So usually the stage 4 lung cancer patients, the female patients, when they're told this, they generally feel a little bit more comforted. How does chemotherapy work generally? It affects the actively dividing cancer cells, right? But we want to do better. Chemotherapy has been there. Chemotherapy has toxicities. How can we do better? And this is the analogy I always talk to my patients about, right? If you have a forest of trees and you have just one tree that is sick, you don't want to go and bomb the entire forest just for this sick tree. Correct? And for chemotherapy, sometimes it's a bit like a nuclear bomb. It's not targeted. Boom. Good cells, bad cells in the area are affected. We want something that is more targeted. Meaning that if I have a sick tree in the forest, I just want to remove the sick tree without affecting the rest of the normal cells, right? So that is when we have targeted therapy. And this is something that we are very proud of in lung cancer, because in lung, compared to all the other cancers, lung cancer has seen this growth of personalized medicine rapidly in the last 10 years or so, because you can see that we are able to now detect the exact genetic mutation that drives the cancer. And depending on what mutation you have, each of these you can see that each of these genetic mutation has a completely different set of drugs that is given to the patient, right? So this is amazing, because most of these targeted drugs are oral treatments and generally fairly well tolerated. And what is interesting is this EGFR mutation that you see, right? In fact, in the Asian countries, about close to 50 to 60% of our lung cancers have this EGFR mutation. This EGFR mutation happens mainly in female non-smokers, right? Which is the sort of lung cancer patients that we have in Asia. This is very different in the Western countries, where a lot of their lung cancer is due to smoking, and you can see the EGFR mutation rates are not so high. And this is a CT scan of one of my patients. You can see this is a patient with stage 4 lung cancer. All the white spots in the lungs is cancer cells. But this patient had an EGFR mutation, was started on an oral targeted therapy, and within 6 weeks, you can see the lung looks almost back to normal. Yeah. And the next thing I want to talk about is immunotherapy, because this is what all the patients who come into clinic always ask about, can you please give me immunotherapy? And the reason for this is because immunotherapy has been the face of oncology for the last few years. It has appeared on many magazines, and rightfully so, because immunotherapy has changed the face of oncology. In the past, where we said, stage 4 cancers cannot be cured, immunotherapy has changed that, right? These two men here are the founders of immune checkpoint inhibitors, right? And they won the Nobel Prize in Medicine in 2018 for the discovery of immune checkpoint inhibitors. And essentially, how does immunotherapy or immune checkpoint inhibitors work? Don't worry about this slide. Is essentially what happens. You have your white blood cells in your body. White blood cells in your body are supposed to attack and kill cancer cells, but your cancer cells are very clever. They tell your body, hey, I'm your friend, go to sleep. So immunotherapy, what it does, it's injected into the body, and it tells your white blood cells, hey, we have enemies in our house, please wake up and attack them. So immunotherapy essentially is harnessing your own immune system to help you to fight cancer cells. Yeah, and I want to share some of my cases, share some case scenarios or some of my patients with you. So this is one of my patients. That when she first came to see me, 35-year-old lady, she's a Filipino lady, never smoker. She's a preschool teacher, and when she came to see me at that time, she had just delivered a baby. She had a 2-month-old baby. She had an older daughter that was 11 years old. She presented with a cough for 4 months duration, but she was pregnant at that time. Because she was pregnant at that time, she had seen many GPs, right? They were saying that she had cough, but no one wanted to do an X-ray on her because she was pregnant, right? And so everybody told her, oh, this was pregnancy related. Don't worry too much about it. But after she delivered the baby, the cough persisted and she started coughing out blood, right? So husband was worried, brought her to the emergency department, and this was the scans that was done to just, that white patch that you see there is not supposed to be there, right? And to make a long story short, she was essentially diagnosed with stage 4 lung cancer. Right, this was as devastating as it can be, because I still remember the day when she walked into my clinic. She was carrying a 2-month-old baby, and her husband was there, and I had just come back from maternity leave at that point of time, when after I had my second daughter, and it was just devastating to see her. To see her like that. And the silver lining in this entire thing was that her tumor had a mutation called the ALK mutation, right? And so I started her on an oral tablet. When she came to see me, although she had delivered a baby, her weight was only 38.5 kg. She was having persistent cough. 2 weeks within starting the medication, her cough had improved, her weight became 40 kg, and you can see that her lung looks much better already. And this is her scans over the years, and number 4 is her latest scan that was done recently. And this is that little baby that was the 2-month-old girl, and who is now 8 years old. And I knew this very clearly because she's the same age as my daughter, right? So mother is still a preschool teacher, still teaching in the school. Daughter was studying in the same preschool where the mother was teaching. And whenever I see her, I always ask her, what do you want to become when you grow up? And then she will tell me she wants to be a doctor. So this lady still has stage 4 lung cancer, right? She's still on medication, but it's no longer seen as a terminal disease, but more like a chronic disease, right? She needs to take medications long-term to control this disease, right? This is another one of my patients. This is a 40-year-old Chinese man. He's a chronic smoker, and he's got diabetes, high blood pressure, heart disease, and he's only 40 years old, right? And he came to see me because his wife dragged him to see me, because he was having a persistent cough, some difficulty breathing, which he said that was due to his smoking, and they were going to get married. So they were going to go on a long honeymoon. The wife said, okay, better go and get checked. But lo and behold, when we did the scans and checked him up, he had this big tumor in his lung, and the cancer had spread to his brain. Right, this was stage 4 lung cancer, right, and he was getting married in 2 weeks' time. Right, so in the first conversation, the wife looked at me, I looked at her, and we said, like, what to do now, right? And so initially we gave him radiation to the brain mets, and we started him on immunotherapy because one of his markers suggested that he's going to respond well to immunotherapy. And you can see this is his scans over the years. I don't have one of his latest scan, I didn't put it up, but this is this gentleman that is here, right, from 2018 till now. That's his wife next to him. So this gentleman is still on immunotherapy, but he is doing very well. Cancer is very well controlled, right? They still obviously, he always tells me it's very important to live life to its fullest. So he every time he sees me now, he always tells me where he's going for his next holiday. Right, and this is one of my patients, and he's very young man, 40-year-old, and this is a video that he created. Maybe we can play this.
The only way you can know, you give it all you have, and I hope that you don't suffer, but take the pain. Hope when the moment comes, you'll say, I did it all. I did it all. On every second this work could give, for some 80 places, the things that I did, else every broken bone, I swear I live. Hope that you spend your days, but they all last.
So that's my favorite video to always share, and he obviously doesn't look like a lung cancer patient, right? So I will end off by saying while cancer incidences are on the rise, treatment of lung cancer has evolved greatly, and in many times lung cancer is no longer viewed as a terminal disease. And with that, I thank you for your kind attention and happy to take any questions that you have.
Thank you so much, doctors.